My name is Brianna Overeem, and for my final presentation for our healthcare ethics class, I have chosen to focus on and further my knowledge on the specifics of navigating mental health in today's world, as well as the role of age and self-perception in mental health stigma. The impact of stigma on mental health, age differences, and help-seeking behavior. Stigma surrounding mental health can often be divided into two forms, which we'll talk about today. Public stigma, where society often holds negative views about mental health, and stealth stigma, where individuals internalize those views. There are age-related differences in perception and internalization of stigma, which all contribute to disparities in mental health care utilization. Stigma affects different age groups in different ways. Older adults, particularly those who are over 65, experience higher levels of public stigma. Society often views mental health care as unnecessary or shameful. Adults over 65 often struggle from self-stigma as well, where they begin to internalize these beliefs. Additionally, they face bias in healthcare settings, including ageism, where their mental health concerns are often overlooked or dismissed and noted as a part of aging. On the other hand, younger adults, though often less affected by public stigma, still struggle with self-stigma and are often reluctant to seek help due to the fear of judgment. Mental health stigma is a significant barrier to seeking help, and the consequences of not addressing mental health issues can be severe and detrimental. Where individuals avoid treatment due to fear of judgment or discrimination, their conditions can worsen over time while going unnoticed. Mental health disorders such as depression, anxiety, or PTSD can escalate quickly and affect daily life and may often lead to more complex issues. Stigma often delays this help-seeking behavior, especially in younger people who may be worried about being labeled. This delay in treatment, as previously stated, can lead to poorer health outcomes. Untreated mental health issues are often linked to physical health problems like heart disease and even poor immune functions. For older adults, the effects of stigma can be even more pronounced. They may experience cognitive decline, increased physical health issues, or isolation because they avoid seeking help for their mental health. Ultimately, these untreated conditions can spiral into more severe challenges, making it harder for individuals to maintain their health and well-being. What is being done? The efforts to reduce stigma in mental health. There are several ongoing effects aimed at reducing mental health stigma, which are helping individuals feel more comfortable seeking help. There are age-specific programs targeting both youth and younger adults. One example is the initiative like Active Minds, which provide peer-led mental health support on college campuses. Another program, like Healthy Ideas, helps older adults recognize and manage depression and help with more accessible telehealth options. This graph, as presented, is from Active Minds' organization. This is their 5-year strategy plan in helping mental health stigma. To effectively address mental health stigma, there are several steps that can be taken. First, promoting open conversation is essential. We need to create environments in schools, workplaces, and communities where mental health can be discussed without fear of judgment. This can be done by hosting mental health awareness days or panel discussions where individuals share their personal stories, which help to show others that they are not alone. Raising awareness through educational campaigns is also crucial. These campaigns should provide clear information about mental health, including common disorders and available treatment options. Resources should be easy, accessible, and available to everyone, whether through websites, apps, or printed materials. Another important step in increasing representation of mental health is in the media. We need more accurate and empathetic portrayals of mental health challenges in films, TV shows, and social media. It's important to feature diverse voices, as representation from people of different backgrounds can help break stereotypes and challenge harmful portrayals. In addition, creating supportive policies in school and workplaces is key. Mental health programs in these settings can help normalize seeking help and provide necessary resources. Schools and workplaces should also develop clear mental health policies to ensure that people can seek help without fearing negative consequences. Culturally sensitive care is another important aspect. Mental health professionals should receive receive training in cultural competence so that they can have a better understanding and meet the needs of diverse populations. Ensuring that language barriers are addressed and services are tailored to different communities can go a long way in reducing stigma. Normalizing therapy and counseling is crucial for changing attitudes towards mental health. We need to work to make these services more accessible, including offering affordable therapy options and promoting the idea that seeking help is a sign of strength, not weakness. Finally, promoting peer networks can provide a safe space for people to share experiences and support one another. Pre-led support groups can be particularly impactful as they offer a sense of community and understanding. By focusing on these actions, we can create a society where mental health is treated with the same respect as physical health, and stigma may no longer prevent individuals from seeking the help that they need. These are the references that I used to do my research and inform myself further and provide my presentation. Thank you.